Hey guys, today is March 8th. We're going to talk about the second domain of athletic training. Each week in the month of March, on Mondays, we're going to talk about a different domain of athletic training. There are 5 of them. Domain number 2 is the clinical evaluation and diagnosis of injuries. Athletic trainers diagnose injuries after evaluation of a variety of injuries, including musculoskeletal conditions such as muscle strains and ligament sprains, broken bones, other musculoskeletal injuries such as those. We also clinically diagnose things such as concussions, and we are there to evaluate head injuries and prevent further damage in athletics. We also evaluate general medical conditions and have the skill set to utilize things such as a stethoscope, a blood pressure cuff, and take a pulse. Those sorts of things to identify red flags that may need to be referred to a physician and referred for further care. Athletic trainers are involved in the clinical diagnosis of injuries during an evaluation on the field, in the athletic training room, or in the clinic. We utilize different skill sets in our evaluation process, whether it's on the field, on the sideline, such as inside of the sideline or tent, in the athletic training room, or like I said, sometimes in a physician clinic, that type of an environment. Things we are looking for are things that we can treat ourselves, and also things that need referral. What we are skilled to know when an injury needs to be referred to a physician. And we work closely with our team physicians to manage injuries such as ankle sprains, ACL tears, shoulder dislocations, those types of musculoskeletal conditions, as well as things such as concussions. Athletic trainers are on the front lines. We are there when an injury occurs. That is our goal, is we want to be there in the athletic world when an injury occurs. Now, we know that only 35% of high schools across America have a full-time athletic trainer. That number certainly needs to go up in order for us to fulfill our mission of being there when an injury occurs. But that is ultimately the goal of the athletic trainer, is to be on site when that type of an injury occurs. Each week during the month of March, we're going to talk about a different domain of athletic training. Join us on Mondays for videos just like this as we talk about those domains. Today's domain is domain number 2, the clinical evaluation and clinical diagnosis of injuries. Make sure and follow along on Facebook and Twitter, hashtag Essential to Healthcare and hashtag NATM 2021.